this. 200 years ago, the average person didn't live past 40. Just 40. If we were sitting in 1825, how many of us would already be gone? 100 years later, we did well to live until 57. Today, life expectancy in the UK is around 82. These are extraordinary gains. We are living longer, healthier lives. Technology is transforming diagnosis and treatment. Conversations around mental health and menopause, once taboo, are finally entering mainstream. But something is breaking. The very foundation of our healthcare system is cracking. It's crumbling under the weight of growing demand, rising costs, and the relentless pace of innovation. Every day, we hear the horror stories. Endless waiting lists, patients left in corridors, overworked staff, impossible working conditions. So, what's holding the system together? What is stopping it from collapsing entirely? The answer is simple. People. Our healthcare workers. Brilliant, compassionate, deeply committed individuals who have become the glue holding together a system under immense pressure. But the cracks are widening because they're walking away. Not because they stopped caring, but because they are breaking under the weight of care. They are not weak. They are not lazy. They are crushed by a system that has forgotten one crucial thing: to care for its carers. So today, I am here to ask a question we have avoided for far too long. Who cares for the carers? That question haunted me one Sunday morning as I sat in my car outside the church, tears silently streaming down my face. The preacher had just delivered a message on stress and burnout. I expected a gentle reminder to take it easy. But what I got was a mirror. He began listing the signs: lack of sleep, constant fatigue, anxiety, panic attacks, trouble sleeping, trouble focusing, emotional numbness, snapping at loved ones, and the one that cut the deepest, a loss of identity. I sat there, frozen, box by box. I ticked them all. And in that moment, sitting alone in my car, the floodgates opened. I wept. Not just from exhaustion, but from a deeper, more terrifying realization. I needed care. And no one had noticed. Not my family, not my colleagues, not even me. You see, I was a care home manager. I supported vulnerable people. I led an incredible team. I was a strong one, the glue, the fixer, or so I thought. But behind the strength, I was depleted. I was burning out, quietly and invisibly. That moment led me here to this stage, to share something I now know to be true. When we care for the carers, we don't just save individuals, we transform the entire healthcare system. The reality is, I am not alone. According to the World Health Organization, at least a quarter of health and care workers report signs of anxiety, depression, or burnout. A recent NHS survey found that 45% of staff have felt unwell due to work-related stress. 35% of NHS doctors are so tired that their ability to treat patients is impaired. And 71% of GPs report compassion fatigue. And the consequences are not just personal, they are systemic. Burnout doesn't just harm the carers, it puts patients at risk. It has been directly linked to medical errors, lower patient satisfaction, and a decline in the overall quality of care. Sadly, we have normalized burnout. We call it part of the job. Chronic understaffing, missed breaks, long shifts, trauma on repeat. And we expect people to just keep going. But healthcare isn't a machine. It is a relationship between people. And the people who care for others are breaking. So the real cost is human. It's Hilda. I met Hilda a few months ago. Hilda had dreamt of becoming a nurse for as long as she could remember. She made it through late nights, exams, placements, the pandemic. And finally, she stepped onto the ward as a newly qualified nurse, bright-eyed and ready to make a difference. But just 1 month in, she was already thinking about quitting. She told me, "I barely eat. I cry after shifts. I feel invisible. No one is listening." What began as dedication quickly turned into depletion. Hilda was ready to give up. And here is the heartbreaking truth. There are thousands of Hildas. Care assistants, nursing associates, paramedics, porters, doctors, drivers, midwives, students, therapists, people who give everything until there is nothing left to give. And far too often, we lose them. Not because they lack ability, but because they lack support. So, the real cost, yes, is human. It's Hilda, watching her dream become a daily source of anxiety. It's me, pushing past breaking point without even realizing. It's the patient who senses that the person treating them is hurting too. When caregivers are just surviving, care becomes mechanical, detached, empty, and healing suffers. Let's stop asking our care workers to be superhuman. Let's start making it safe to be simply human. Healthy humans who are allowed to feel, to rest, to ask for help. Imagine a culture where the well-being of care workers wasn't an afterthought, but the very foundation of how we deliver care. This isn't just a nice idea, it is already happening. In Sweden, work-life balance and employee well-being are foundational, not optional. In the Netherlands, staff well-being is monitored at a national level. Mental health checks are routine. Burnout is spotted early with clear protocols for support and recovery. And even here in the UK, there are sparks of change. Some NHS trusts are creating well-being hubs, peer support networks, and reflective spaces. They are not perfect, but they prove what's possible when we decide that carers deserve care too. And these are not miracles. They're the result of intentional choices, policies, and cultural shifts that say your well-being matters too. So let me ask you one more time. Who cares for the carers? Each of us has a role to play. If we value the health and social care we rely on, we all share a responsibility. A responsibility to speak up, to act, to ensure that those who care for others are cared for in return. How do we do this? If you're a manager, be the empathetic leader you once needed. Don't just ask, what have you done today? Ask, how are you coping? Support doesn't have to be complicated. It starts with a rota that allows for a healthy balance. Breaks that are not just permitted, but protected. If you are a policymaker, treat emotional support as essential infrastructure. Fund mental health programs for frontline workers like lives depend on it, because they do. If you're a colleague, check in and really listen. A kind word, a shared coffee, a quiet moment, it matters more than you think. If you're a patient or family member, offer kindness. Ask your nurse or doctor, are you okay? That small question can mean everything. And if you're a healthcare worker, please hear me. You're not a machine. Your well-being is essential. Rest is not a weakness. It is not selfish. It is sacred. So this talk isn't just about healthcare workers. It is about all of us. Because one day, you will need care. And the person standing beside your hospital bed, holding your hand, wiping your tears, and carrying the weight of your fear will be someone we either supported or failed. So ask yourself, what kind of world have we created for them? We chase innovation for tomorrow. It is time we fight for the people who carry us there. Thank you.